So now, when somebody goes to a doctor, the first thing they go to a doctor is because they have some symptom. One of the easiest symptoms to spot is pain. And I've heard it said by somebody, being said by somebody, that pain is not actually in one part or another. Pain is in the brain. So is that accurate to an extent, or is it?
It is definitely accurate. To not an extent, it is accurate to the most of it.
Okay.
Because the whole processing of pain happens in our brain.
Okay.
Okay. Just like touch or just like vision, we are able to perceive vision. So similarly, pain is one more sensation which is finally perceived by the brain.
Okay.
So it is something like you have sensors all over your body, and then there is a stimuli which is not good, it's harmful for your body. Then you get the perception of pain. And it has different layers to it. Like say if you have a small pinprick, you have a sharp pain. And if you have a bad pressure or something, you have a dull pain. So pain has multiple, layers to it. So yeah, definitely it gets processed in the brain finally.
So there is this negative connotation to pain, right? Pain is undesirable. But do you think it is actually a good thing?
Yes.
That you feel pain?
See, pain is one of the first symptoms. The body is telling you that there's something wrong happening in the body. Okay. So rather than trying to look at it or trying to, go inward and see what's happening, we try to outwardly, take support and help from other people. In fact, if you're having pain is the first, as you rightly said, it is a symptom. You can't say it's either a good or a bad symptom. It's just telling you, it's just saying, hello, hey, there's a problem.
It's an indicator.
There's a problem here. You please look into it. So I'll give you the very simple example for that. Is that now since we have become sedentary, always sitting, and we don't do physical activity as much as we used to before, we not able to utilize our back enough. Okay, the muscles get weak and the bones are getting more pressure because we always slouch and sit like this. So eventually, what happens is the muscle is not supporting the back enough, the bone is fine enough. So the bone, since it is hard, it will tolerate that stress. But between the bones, there is something called as a disc, which starts getting damaged or getting degenerated because it is not being supported properly. Because when you are erect and proper posture is there, the muscle actually supports it well so that the stress is not directly falling onto the disc. But then due to our habits, the disc gets damaged and immediately you will start having back pain. Now, what do we do for the back pain? We, in order to prevent our performance and our routine activity to get compromised, we pop in some painkillers or some other relaxants and then we continue to do our work. So, in this sense, what are we ignoring the pain which is coming from your back, and you try to continue your activity. So, with this, what's happening is the painkillers. What they do is they reduce the pain by reducing the inflammation around that area, because something is injured there, and the inflammation is the one which causes pain, the sustained pain. The sustained pain is caused by the inflammation. So that is reduced by the painkiller, and you continue to do your activity. Now, what happens? You can guess. Take a guess. So, the inflammation is reduced. So, the injury is not repaired yet. And you are back to your normal activity. So, the injury increases.
Increasing the injury.
The injury increases. And I have seen this n number of times in my practice, that patient would have taken a muscle relaxant or a painkiller and gone back to work, and another in a week's time or in a 2 weeks time comes out more severe pain than he was before. So, if you had listened to his pain, it's telling you that this particular moment is causing me pain. So, what you should do, you should avoid that moment. Very simple. So, in spine, any sitting posture will cause pain. So, that's when you should lie down. So, lying down will offset the pain, and you have to give the time for that injured area to heal, which we don't do that. So,
but then it would not also make sense to say whenever we have any sort of pain, we just go to the doctor. That would be a bit of an overkill.
Yeah, it is definitely not. So that's the reason why you take rest. You don't have to go all the time to the doctor. So when the pain is not getting better with your what you're trying to do, then you take help from a specialist, isn't it? That's how it is.
Yeah.
So what we used to do before, I'll give you an example. When we were probably 30-40 years before, when we had this kind of symptoms, we used to take some Amrutanjanam or something and then we used to sleep. So the sleep used to take care of it. It used to repair the whole thing.
Yeah.
So that we're not doing nowadays because we're so busy with our work. We have to finish some. We have deadlines to meet and all that, and then we are, I think, spoiling our body. We're not listening to what's inside, what the call from inside basically.
So there are different kinds of pain, right?
Yes.
So what are those different kinds of pain?
Different.
From the medical standpoint, from the physiological.
Pain is actually a pretty vast topic. As in, okay, I can give you a little heads up on that. So there is pain which can be specific, like when you say that there is something, a thorn pricking you.
Yeah.
Okay. And then there is a pain which is very dull as well. Okay, it's very diffuse. You can't really pinpoint to one particular thing. So this pain, these two are they're given different names to it. Okay. One is called a somatic pain. That means you can actually pinpoint one area, and there's another dull aching. So that is visceral pain, you can call it. So so this kind of a pain has different set of nerves and neural architecture behind. Okay. So eventually, but then there is an area in the brain, okay, which takes care of integrating all those things. Okay. So there's a place called thalamus. Okay.
Yeah.
Thalamus is a place where all the sensory, not just pain, all the sensations get integrated, and then you get an understanding about the pain and all those things. So it's if you really want to have a discussion, probably we can have a discussion only on pain once, so that we can really elaborate on the different kinds of pains as well.
Sure, we'll do that. So we'll do